Hey everybody, Thomas Vanderkin here from Lenovo. I'm super excited to have Dr. Bob Monteverdi on the show with us today. Hey, Dr. Bob, welcome. I'm so glad to have you. I'm really excited to talk today about all the healthcare solutions that Lenovo has. To learn a little bit more about you, I checked you out on LinkedIn. You got a lot of really interesting history, a physician, general manager. Today you're the Global Health Solutions Director at Lenovo. But why don't you tell us a little bit about yourself before we get started?
Sure. If you've been around a long time, you rack up all sorts of titles, Thomas. So I've been in healthcare probably the better part of 4 decades in a variety of roles, in practice originally, and then in, gosh, the last 3 decades plus on the vendor side of things. And spent time in provider, payer, life sciences, pharmacy, retail space. Been a wonderful ride. And you learn a lot along the way, and you just keep learning. It never seems to stop.
Great. Can you begin by explaining the term virtual health and what that means for you and Lenovo?
Sure. Lots of different words out there that sound pretty similar, and people use them in different ways. But when I talk virtual health, if I thought of an overarching definition of that, it's really just healthcare collaboration between either professionals or professionals and patients, but more remotely, less face-to-face, more remote types of interaction. The components of what virtual health really can encompass are multiple. When we were doing focus groups just a little while back, and we'd talk about virtual care, the one thing that resonated was telehealth e-visits. Once you move beyond that, it really wasn't a concept that most people were grasping. And I've seen that the shift, the paradigm shift, the perspective change over the last couple of years dramatically when you now engage with folks about virtual health and that whole area. E-visits, it's still a key part of things. Quick telehealth visits, the most basic component, but the definition's broadened clearly. And one of the subcomponents of virtual health, I label virtual care, as many do in the industry, and that's a broader one. That's more the interaction of patients that are actually home and physicians remotely. So that concept is there. That's similar to telehealth, but it's not just a quick visit. It's things like driving patient compliance, having third biometric kits that are set up for patients to be able to take blood pressures and glucose and pulse oximetry, oxygen levels, things of that nature, and actually, trying to drive patient change, patient behavior, patient modification, patient compliance more remotely. There's a lot of value in that, which I'm sure we'll talk about as we go through. But that whole remote patient monitoring capability added into the mix, which is especially effective for chronic care patients, as opposed to the quick e-visit, which is usually more of an acute situation. Those are two of the key components. And there are others, we've put out a solution on patient in-rounding and for physicians to actually do the hospital rounds that they normally would do face-to-face, but do those remotely. So you've got patients in hospitals, in beds, and instead of physicians hitting each room physically, running from patient to patient, room to room, but more in a virtual perspective with a video conference. And that's become exceedingly important. Of course, there's always been physician shortages, and you want more efficiency, but with the pandemic situation, more of a factor. And there are other components as well, but I think those are some of the key ones you think of with virtual health.
Yeah, I think of the kind of inherent risk, I guess, in a doctor getting up at 6 o'clock in the morning and then doing the rounds and visiting every patient room by room, which is kind of the way it's always been done, which is so important to a successful, treatment and moving a patient out of the hospital and through a healthy, but just for the doctor's health and the patient's health, just moving room to room just doesn't, it's just very hard to imagine how you can do that in a safe way in this COVID environment.
Yeah, you're right. And you get the PPE angle, the personal protective equipment, and the initially great shortages, but constantly high expense of that, and then just literally, you alluded to the factor of infection spread. You want to limit that, so the least amount of that, the better, of course, and then the efficiency angle on top of it. It's just a fact of life with rounding.
Yeah. Of all the industries we talk about, healthcare is certainly the most personal, right? So even if they don't mind, I'll take a second just to share a story where this has impacted me. My wife was part of a adult bone marrow transplant clinical trial where she was able to go through that process at home instead of spending 6 months, at Duke University having that done. She was able to do it at home with a tablet, with a doctor every day, and then a nurse coming just for a little bit of time to do the blood draws and what was needed. And it was a complete success. She was actually part of the follow-up studies about how to replicate that, and just there's germs everywhere, so they said just keep you in your same germs which are in your house rather than exposing new germs in the bone marrow clinic. So it was a privilege both for her to be part of our family during that 6 months, but also the success of that virtual care that she got. So
that particular example, very interesting too, because I didn't bring the clinical trial aspect up, but think of the virtual care play, and you definitely have some personal familiarity with it. But in our world, we've got a kit, based with a Lenovo hardware device, these third-party additional biometric devices, software, right? Think about assistive AI, virtual type nurse that can kind of prod you along during a healthcare visit, right? But now take that, apply it to the life sciences space and clinical trials, and the term that's popping up much more frequently this year is hybrid trials, to supplement the face-to-face visits that normally would occur for subjects in a trial, and supplement it with the same kind of kitting and virtual assistant approach. So that's actually another place that Lenovo is going as we move forward with our broad virtual health strategy. A lot of talk about that in the industry, not quite as much execution yet, but I would say most clinical research organizations we've engaged with and pharmaceutical manufacturers in the life science space are trying to go down that path, because this is really challenging in a pandemic. Great story there.
I'm personally thankful for you and Lenovo and all the other doctors and researchers who were personally impacted me and my family and my wife. So she's doing great. She's home. She's everything's going well, but it was quite a journey we went through there for a while.
Yes.
The virtual aspect was a critical part of it.
Great to hear. Yeah.
But what are some barriers for adoption? You mentioned that it's not ramping up the way you expected amongst patients, hospitals, industries. How are you overcoming those barriers?
Sure, it is ramping much more in the hospital space. I'm seeing it a little slower in the life sciences space. So just to clarify that point. But I've been in healthcare all these years, 4 decades, and the number one thing is just that human nature that's resistant to change. I think that's probably one of the biggest factors. Even when there's something that's a much better way, quote unquote, to do something, there's still always everything from healthy doses of skepticism to, geez, I've always done it this way. Do I really have to go, change my behaviors? I think that's a big part of things, and the way you try to overcome that, it's you try to make whatever solution you're offering, no matter what it may be, easy to users, give them trial type periods, educate them along the way. With virtual care, it's more the kit in a box. Can I just open this thing up, push a button, and get running really quickly? That's probably one of the biggest barriers. But the barriers change depending on who you're talking to. So if I'm talking to patients and providers, that's an important aspect. But if I start talking to IT folk, right away it's security, privacy concerns. My own systems, will this work? So, you got to think about things like HIPAA, of course, where if you have a violation of HIPAA, $250,000 fine per occurrence, and you got to knock on the door of the media and proactively tell everybody what happened. Not great PR. So things like limiting PHI, encrypting in storage and in transit. When we do virtual rounding visits with patients and docs, we don't record the encounters. We make sure there's no ability for that to happen. We lock down the devices, as long as the organization agrees that makes sense. So you can't have third parties kind of coming in and bombing, things of that nature happening. And then integration. If from an IT perspective, you want to make sure you can integrate in with key systems, usually electronic health records. You're sitting on the finance side, the skepticism is, well, we got to invest money in this thing here now. What's the TCO, total cost of ownership? What's the return on investment? Both, hard dollar and soft dollar. They both matter. Am I going to get increased efficiencies? And what are the other nuances? Am I going to get more patients now because you're increasing my geographical access? Given now that it's virtual, if someone's living 2 hours away, I can get to them. They don't have to have a 2-hour drive into my facility. Can you provide this supplementary care virtually to reduce unnecessary readmissions back into the hospital? Because if you have a readmission, depending on the disease state, within 30, 60, 90 days, for a same diagnosis the patient had, you get penalized. It happens every day to systems around the country. Lastly, if there's two things that I've seen motivate healthcare, it's reimbursement and it's government compliance. So if you have one of those two drivers, and with telehealth and with remote patient monitoring and chronic care management, they're now reimbursable. Center for Medicaid and Medicare has changed over the last couple of years, broaden that, keep increasing the codes. There's even grants available for going down these paths. So when you look at all that, if you can improve the outcomes, reduce your costs, increase efficiencies, get patients engaged in their own health care, make sure it's rock solid in terms of a security perspective, and drive greater patient engagement, access, satisfaction. Those are massive home runs. And then you got this thing that, like COVID, that comes along that becomes the catalyst for more of this, which is exactly what's happening, not to mention validation for virtual health as a whole.
I think a lot of us have experienced the benefit already of a virtual visit, both for the doctor and for ourselves. It saves us a half a day off work going into the doctor's office. But are we missing a personal touch where a doctor knows you, knows your body, can see things that maybe they wouldn't see on a screen? How do we overcome that?
A couple of ways. One is to recognize that all these virtual types of offerings and solutions, they're supplementary. They augment the care. They don't replace it. And you're still going to see your doctor. You're still going to have times you're going to go in the hospital, depending on what condition you have. That's just a fact of life. But when you do have these encounters, if you can use whether it's virtual avatars or a little bit of assistive AI, the old chatting and tap chatting, some video, some personalization in the mix, whether, Thomas, how are you doing today? Thomas, did you eat your breakfast today? Thomas, why did you have candy for breakfast today? It's probably the best move. That interaction helps a lot. And then we shouldn't underestimate convenience, because as hard as behavior modification is to change, I just had literally my first e-visit as a patient with my doctor, and I was scheduled and said, sorry, not coming in for my lab tests, and we didn't do those remotely, obviously, but it was great. I mean, I know my doc, and here we are just chatting just like you and I, and it's a lot of benefit to that. Plus, convenience. I don't want to get a COVID infection at this point in time. Save me the same couple of hours that you just alluded to, and all this helps me stay healthy too. Because if I can do these things remotely and maintain the chronic diseases I have and avoid other ones, whether it's through more frequent readings on devices or just adopting better behaviors, because I know someone is monitoring me and I have care plans in front of me on what to do for myself as a patient. All of that helps, but I still think that overcoming that behavior is the big one. So it's you've got to do all these things to try to help that to happen.
You mentioned the number of devices. I'm fairly tech savvy. Obviously, I've got devices everywhere that are constantly monitoring me. I got a Garmin watch that tracks me when I run, a sleep number bed that tracks my breaths per minute while I sleep. Lenovo sent me a blood pressure cuff so I can attach that.
I've seen your videos online. You got every gadget going.
Yeah, but how do the people who are less tech savvy or maybe don't have access, are they going to get left behind in this revolution?
I think the one parameter you have to have is you need some element of connectivity. So, and there are certain pockets in the country where you just may not be able to do this as efficiently. But, LTE, Wi-Fi, broadband, one of these is essential. Multiple is great because you got backup capability. So that's one aspect. And then I think the burden's on the vendors too, to make things as simple as possible and as intuitive as possible for lower tech type patients. So whether you can have everything assembled, like I said, in a kit, and literally, someone opens this thing up, hits a button or two, and minimal investment of their time and less taxing of their technical capabilities is smart. Locking down devices so they a rounding solution, for example, it's exactly what we do. That patient's in the bed, they can't inadvertently get out into other places. They can't call the patient down the hall. They can't go out and start rolling through the web unless there's a desire to have this be a broader entertainment type device. But in general, it's still that ease of use balanced against security, making people feel comfortable quickly. And you don't get a lot of shots at that. If you put it out there and it's just a difficult to use, or it's not working. Patients, especially less tech savvy, get frustrated. I think we all do as consumers. I see you wrapping your boxes, and if it just gets to be just too much effort, let me take this and just put it aside, and I'm not going to do this. So it's important.
Yeah. So Lenovo, I mentioned Duke, and when I go to Duke, there's Lenovo PCs everywhere. But I don't traditionally think of Lenovo beyond the PC in a hospital space. I think more of like GE, Siemens, those kind of companies. But how is Lenovo expanding, and what benefit are they bringing to the overall healthcare?
Yeah, well, like at Duke, we're in just thousands of hospitals around the nation with all sorts of different hardware devices and software and services too. But the role our team has is to broaden that reach, and our little unit here is called Lenovo Health, actually, with the emphasis on health. We are driving more solutions, and we've assembled a good, knowledgeable, extremely experienced set of SMEs in the healthcare space. We've got clinical folks on board. We have tight partnerships with other companies that bring clinical value to the table, and we recognize that in order to really be the player we want to be in this space, our strategy is all around virtual health and in driving change and better results at lower costs for healthcare. So we've been at HIMSS the last 5 years. We do a lot of thought leadership seminars. We've been involved with Becker's in the past. We're members of Chime. We make sure we're out there, focus groups, customer advisory councils, thought leadership. Like I said, we are committed to this. We've rolled out a number of really, really good solutions. And when you combine that with a global company that's in 180 different markets, 60,000 plus employees, 50 plus billion in revenue, tremendous supply chain capability, back office operations, logistics. We have the ability to mass produce and pull together, distribute, refurbish, deploy, all the aspects that are really daunting for most clinically oriented software only or services only companies. So partnering is one path there, and evolving some of these solutions and additions to the solutions in-house is another. But the combination, and then we bring this to the marketplace with our brand recognition, our financial strength, our sales forces around the world. So it's an ongoing direction that we have, and I think we've made a lot of progress and intend to make a lot more.
I have a two-part question, and it's related to both this data, the value of the data that we could gather from all these devices. I just think of myself, like I said, with tracking me every which way, whether it's sleep or I'm my run or my health, my app, my watch, whatever. That seems like having that data could bring a lot of value to improve healthcare at a kind of big data level. But also, how do you balance the value of that data to improve the effectiveness of healthcare, but also the security and HIPAA compliance and all those things?
Yeah. Well, obviously the security aspects are critical. So when we put our solutions out there, we try really hard not to get engaged with the PHI. We're not bringing the data in and doing analytics on it at this point in time at Lenovo. Our main goal is to help the patients, help the providers. So minimize PHI, of course, encrypt as necessary, put all the security precautions in place. But then the other aspect of it to make sure you get value out of that data is, it doesn't end once you just collect this and send it off to your physician or your nurse and they're aware of what your blood pressure reading is. As today's world continues to evolve, this wasn't true a few years back, but the EHRs, the electronic health records, now are opening up and actually incorporating more and more on an increasing basis this patient information. So, large entities like Epic, for example, have gone down that path and are opening up that door and are looking and encouraging vendors like ourselves to take this third-party data and bring it in and store it in that electronic health record. A few years ago, it was a little more back and forth with the healthcare organizations. Now, do I really want this patient-generated health record data mixed in with my electronic health record? But you kind of segment off a little bit, say this was a telehealth patient encounter, bring the data in, and organizations can control how much of that they want. Do I want Thomas's 13 blood pressure readings every day, or do I want maybe one in the morning and one in the evening? You may take it 13 times. But that balance is important. So it's the usual. It's security, obviously, versus ease of use, and then it's also the back end, that value. So the more information within reason that providers have, the more current that information is, the more frequent that information is made available, in theory, the better you should get as an outcome, and that's exactly what we intend to demonstrate.
It feels like it's inevitable, like self-driving cars, just feels like with all this data, we're going to be healthier. It just makes sense that we can improve our lives by moving to a virtual, and just not having to fill out those same forms every time I go to a different doctor, and to the same doctor that seems like we got to fix that. It's been 20 years or 100 years, can we somehow at least solve that so I don't have to fill out the same, and I'm guessing, what surgeries did my mom have? I have no idea. So it'd be nice if they had real data on that kind of medical.
Can we just stop faxing in healthcare? That would be a move forward.
But what other long-standing issues in the industry do you feel like virtual healthcare can help mitigate?
Well, I'm not saying it's the panacea, but I've been in this space what feels like forever. I've seen a lot of different solutions come along. Very few gain tremendous traction and acceleration. It's always a little slow going in the beginning, and I've seen some big ones, and I think this is one of the ones that's going to go. I mean, the ones I've been involved in, practice management systems very early on for physicians' offices were slow on the uptake, and then people got the gist of this, and providers started to understand the value. Same thing happened with electronic claims. It was tremendous resistance to that in the beginning. If I could just take a bunch of forms and stick them in an envelope, mail them, and put a postage stamp on it, why do I want to pay somebody to set a claim in electronically? There's always an education process, on and on and on. So this with EHRs, so this with mobile devices, and now virtual health. And you start seeing this change in the last couple of years that's really starting to drive more of this. And I think the reasons behind it are people are starting to recognize, and healthcare systems are recognizing the value. So it's some of the same things we talked about, but when you look at more information being collected, more current information, more frequent information, early warning systems. If something's going wrong with my patient, the earlier I know about this and the earlier they know about it, that earlier intervention can get me a better outcome. And just the fact that someone's monitoring you, makes people in general want to go that extra mile to improve. I remember one day my doc's telling me I put in all my stats with literally not just how many calories a day I'm taking in, but how much salt, how many milligrams. I mean, the whole, and he just looks at me and goes like, between this and you on your bike every morning at 4 a.m., you are my model patient. I'm just trying to stay alive as a patient here. So it's a selfish effort, but the more you have of that at your fingertips, the better. And then if you're on the provider side, of course, the outcomes improving, absolutely essential. But you've heard the phrases patient centricity and consumerism. It's really about the consumerization of healthcare over the last 5 years too. People have choices, and when you're going to take your dollars, especially with increasing deductibles and increasing out of pocket overall, you take your money and you're free to go, to whoever you want to go to, whoever you think is providing the best value, best bang for the dollars you're going to spend. So if you're on the hospital or health system side, more patient engagement, reaching out, having broader access geographically, whether it's physical feeder hospitals or virtual health to bring patients in from a greater radius, driving that patient behavior, getting the compliance out of the patient to do the right things to keep them healthy and out of the hospital, and then these convenience factors. This can all be reflected in HCAHPS scores, and in patient referrals, because they're going to refer to institutions they believe are doing a good job. And then there's the efficiency angle, of course. Better outcomes, less readmissions into the hospital, lower cost, more provider efficiencies because there's not enough docs to go around, and this monster of chronic care that is the big issue. We're sitting here with populations, thankfully we're all living longer. Average age is globally is about 80 years now, but we're living longer. You're more prone to get chronic diseases, sometimes multiple. That's where all the spend is. We're spending in the US alone $3.6 trillion. CMS projects this to go anywhere to $5.5–6 million over the next 7–8 years, and that's not a feasible number we can address. When I was back in med school, it was 9% of the GDP. Now it's 18%, and the GDP is a lot bigger, so the spend is a higher percentage of a much bigger number. long-term care, which is mostly the result of chronic care getting out of hand. I've been through the elder care game, and it's out of pocket, and it's like $100,000 a year, easy. And the numbers, Genworth Financial, one of the big players in that space, is projecting $135,000 a year within a few more years as the average price point. I mean, who has an extra $10,000 a month just laying around? Even when you're planning retirement and budgets, these are the killers. So, if virtual care supplementing existing care measures today can help move that needle to any significant degree at all, it'll get us better care, have us living not just longer, but healthier, higher quality lives, which is what it's really all about. Nobody's trying to live till 120 necessarily, but give me 85 good ones, and that's what everybody's looking for, is quality, and that's what our hope is, that these technologies can be applied to improve this overall health of the nation.
Well, I really enjoyed our time together here, Dr. Bob. I always ask everybody at the end, anything else cool you're working on, anything else you want to share before we sign off?
Not a lot I can talk about publicly. Life sciences is another great space. We're just going to try to keep finding more ways that we can leverage this very, very wide banner of virtual health. That's it in a nutshell. And what's great about being in healthcare, you alluded to it before, all businesses are in business to deliver value to customers and to generate revenue and profits and grow, and that's the game. But healthcare, wow, extra noble. Yeah. Just it's what drives most of us, and it's where that passion comes from. Just like you see these providers, these nurses and docs on the front lines that are risking their lives every day. I can't applaud them enough. I can't even envision myself being in that environment today and doing what they do. They are the truest heroes that I have seen, and God bless them all.
Amen. Yeah. Amen. Well, thank you, Dr. Bob. I think it's been a great discussion, and I look forward to talking to you again soon.
Appreciate the time, and I'll keep watching your gadget unboxing videos. They're a pleasure. Thanks, Thomas.
Bye.